Oh, sorry. I'll let you.
I've got it recorded now.
Okay.
All right. Well, so I live in Champaign right now, but I'm moving to Terre Haute.
Okay.
Nice.
Have no idea where yet, but I am.
I also live in Terre Haute, so if you need some advice, you can ask.
Will do. My wife and I have been looking at Sycamore Terrace.
Oh, okay. I was just at their pool today.
All right. We're supposed to talk about what we read and just sort of introduce ourselves, right?
Mm-hmm.
So
There were 4 or 5 questions on the assignment description. I took a picture of them, so you'd want to just start going through with those.
yeah.
I could ask the first question.
Yeah, that's fine.
Mm-hmm.
So it says, I screenshot it, so I'm looking at my phone, sorry. It says, what is your opinion of outcome measures and roles of athletic training? Your opinion on outcome measures, roles in athletic training.
Honestly, I think it has a pretty small role at the moment, just because I think athletic trainers have copped a lot from physical therapy, but there's not a lot, at least that I'm aware of, that are like athletic training specific. Like, hey, this is one that's specifically for your profession, rather than, hey, we kind of borrowed this one from PT and we're sort of making it work.
That makes sense. I mean, as a
Well,
business,
Go ahead.
For me, I honestly didn't know what they were referring to when they were talking about outcome measures. And as I read, I was realizing that we do a lot of that for like concussion stuff, right? And it's just like so well rounded, so many avenues and so many things that we do. And just to even think about trying to incorporate that with all the different injuries that we see, it just was a little bit overwhelming. So I understand what the role was, but I was just trying to figure out how like practical it will be for us as athletic trainers, because we do so much.
yeah. When it came to this, I didn't really know what we had to do, and like you said, it took the reading for me to even understand what this assignment was.
Yeah.
Um,
Yeah. Like when we did the video where we were supposed to be talking about like what our opinions were about outcome measures and everything, I thought I knew what I was talking about. And then I started reading it, and I'm like, I think I'm a big dumb.
Yeah. Same. I think I read like 2 of them first before I just started jumping into the reading, before I read what we were supposed to do or any of that. And then I realized we weren't supposed to read it, but then I was glad I did read it, because I had at least some concept of what I was supposed to be talking about, a little bit.
Yeah.
Yeah, I did my master's here at Indiana State, so I was fortunate enough to learn a little bit about them in the master's program, and then I got some of my preceptors were DAT students, so I've learned a lot from them. But when I was not working with the DAT students, no one used outcome measures, and I don't work clinically at the moment, so I think I still don't understand how to incorporate them into clinical practice.
Yeah. I think part of it too depends on what setting you're in, and how many people you have available to do those measurements. If you're the only athletic trainer at the high school, like I am, I think it's a little bit harder because you just don't have the time for it, like, and how valid is an outcome measure assessment if you have an athlete who didn't complete their whole course of treatment or didn't come in all the time? Like, can you really say an outcome measure would be valid if they haven't really done everything they're supposed to do? As opposed to maybe a collegiate or professional level where they're more likely to come in a little bit more often, and I think the outcome measure would be a little bit more valid at that point. But
I mean, right now I'm just in limbo. I'm not in any clinic. I'm gonna be a GA, but in my undergrad, we never really worried about this. It's like when I talked to the head AT, he's like, yeah, he knew about it, but he really didn't care so much for us to worry about.
right.
And during my internship with the Ravens, they talked about it a lot, but it was all in closed door meetings.
Mm-hmm. I work in
Did you use outcome measures when you worked with the Ravens?
They did, but not us interns. We were more working with Gatorade than we were with athletes.
Yep.
And I work in a high school setting, a private high school, independent school, I should say. And I could see me using this for our kids who like are fresh out of surgery or are past that waiting period where they're restricted and they don't have much range of motion and not supposed to be, they're braced or whatever. And I see them and I do rehab. And so it's more individualized attention with them. So I can sit down, I take the little measurements with the goniometer, like otherwise my goniometer is in the drawer. So it's like when I have those students, which is rare, I could do something like this. But then again, how often, like what would I have to compare my interventions to if I'm doing this, doing that once a year? So.
Right.
And with it, you have to do it more than just the one time for it to even be useful. Not in outcome measurements. If you do it once in a blue moon, you barely get any data to work with.
Right. Yeah.
Oh, in the chat, I went ahead and put all the questions.
Yeah. Saw that.
Thanks. Yeah, I have them written down. Yeah.
Yeah.
I
think this is definitely an area where like PT has a leg up on the athletic training profession because they do this all the time.
Yeah.
And so in that respect, I see it can be a useful tool. And I don't want to say that, we just don't have the time and use that as an excuse to not be doing some of this. But at the same time, this isn't my first rodeo. I've been doing this for a few years now. Like, it's really hard to do, especially because you have such a short time to see our athletes, get everybody out to practice so nobody's missing. And yet you're expected to sit there and do these outcome assessments with these kids. And to say, oh, yeah, just come back after practice and we'll fill it out. Yeah, right. What athlete does that? Nobody.
Right.
So I don't know. I have a hard time with this because there's one part of me that says we really need to be doing this. And the other part of me that says, yeah, tell me how. Like, you show me a high school where this is actually working at, okay. Show me how to do it. But I don't see it being done. Like, I have a number of coworkers because we have a lot of different schools that we contract with, and I can't think of anybody who's currently doing any outcome assessments at any of their high schools.
Yeah.
I may have used it a little bit in my past life when I was in the military because I worked in a public health clinic. I was a medic, so there was a lot of times where we would do outcome measurements for STDs, but it was what it was. I mean, it was just Mommy. It was STD, so.
Yeah.
Now I'm interested to see what like types of the readings had alluded to different types of I don't know, surveys, and they call all kinds of things that the PTs, I guess you said, use. I'm interested to see what is going to be developed for athletic trainers. and how long and how many questions it's going to be.
Yeah.
So, I mean, it can't be like one of them was like 36 or 18. Even that I feel like is too much. Well, even when I'm taking a regular survey, if it's not 5 questions, I'm not doing it. So I would love to see how many questions are going to be on it and how many questions are necessary to be effective in what we're trying to do.
Right.
Yeah.
I'd like to find out if there even is one specific to athletic training. I feel like there's, we're talking about there's 40 some different things for ankles and 50 some different things for the shoulder. And I'm going, I didn't even know there were that many out there. So I feel like I have a big knowledge gap. Like, I don't even know what's out there. So it's very possible there's one that's athletic training specific and I just don't know what's out there.
Yeah.
Do you think working with a high school student that those students would take the questionnaire seriously enough to, this is just asking a personal question, basically.
Some of them would. I don't know that all of them would necessarily, but I think some of them would provide feedback, honestly.
I think it depends on like how long, what type of injury it is and how long it's going to take them to recover. So if it's like a kid with, I hate to say, basic ankle sprain, and it's not like it's a really like not even a grade 1, he just barely tweaked it, so to speak, they wouldn't take the time to do it. But if it's a kid with like a grade 2 and he's really trying to get back, it's going to take a couple weeks. If I have more time with that student athlete, then I think that athlete would be more willing to do it.
For sure.
It depends on their personality as well. I mean, I can see the D1 athletes doing it as well, but maybe the athlete who barely is on the team, he's just a walk-on, might be the type who cares. It all depends on the personality, I could see.
Yeah.
Like I have a hard time just getting my student athletes to sign in on our little laptop so I can record my injuries. So like adding another step is just like, oh my goodness. They put all kinds of stuff down. Luckily I review it and I'm like, hey, put the right stuff down, like don't play with my stuff. So yeah, I think the personality piece has a lot to do with it, and the setting too. It's going to be interesting in high school.
Yeah.
Well, we're about halfway done with our 30 minutes that we're supposed to do.
Is it up to 30 minutes or at least 30 minutes? What was the wording on that?
Hold on. It just says a 30-minute collaborative discussion.
Oh, a 30-minute. Oh my goodness.
Oh, we got this.
I mean, I can always change the speed, make it look like we're talking really slow.
No. Was there anything like you guys read that stood out to you, or?
Let me look at the documents.
I was gonna say.
Took some notes.
Yeah, I've got total brain confusion, so I'm trying to remember what everything was.
Right, one class at a time.
Yeah. I feel like put everything into different binders, like, what?
Yeah, I haven't even started on 710 yet.
I think the theory of it sounds really good. So the one about, oh gosh, which one is it? I think it was the clinical outcome assessment in sport rehab. That's where I really started to understand what was happening. And the theory of it, researchers take all this time and all this effort to help us develop the best tools. And it only makes sense for us to like fill that gap by bringing back the information and letting them know if it works. So that piece of it, it just clicked to me for some reason. I was like, it sounds so great. Just got to figure out how to do that, how to bring it full circle.
Yeah. I really like the discussion around whether assessment should be clinician-based or patient-based. On the one hand, if we're doing it, we're going to make sure we take the time to do the assessments, and, you know, time is not an issue at that point. We'll just make sure it gets done. But, you know, bringing in some of the other readings we've had this week, if you're not taking into account the patient's view of things, can you really consider that patient-centered care if you're not ever asking their opinions on anything? Is that a true patient-centered care if we don't, you know? So I can see both.
Yeah.
I mean, I was always taught patient first. I mean, like, if we keep them there forever for us to rate it, a lot of times the feeling I would get, the patient be like, why am I still here? I need to leave. I don't care. Where's my phone?
Yeah.
That's funny. I am a big, my whole lesson for my student athletes are advocating for your own health. So if you don't want to come in here and I wouldn't let a kid go out if I really felt that their health was in danger. But if they pulled a muscle and they are really like rebelling against me, I'm like, okay, if you want to go and let your hamstring fall off, you do that. I'll see you back in a few days, and then you can learn how to do it the right way. And for me, it depends on the student and depends on the sport and the games and all that stuff and how much time I have to help them back. But I kind of let them learn on their own a little bit and how they need to listen to their bodies. I'm not here to pull you out. I'm here to make sure you go back in, healthy. So that's how I work around that sometimes.
Makes sense.
Yeah.
One of the questions was just get to know each other, so we can do that for about 5 minutes and we're done. You can tell I'm not a big fan of talking a lot. I'm very quiet, and if I'm talking a lot, either I'm really not comfortable or I'm really peed off.
Oh, okay.
Yeah.
That's funny. I could talk all day. See, that's why we're teammates here.
Yeah, for me, it depends on what group of people I'm with. Like, if I'm comfortable, I'll talk for forever. If I'm not comfortable around these people, like, I'm going to tend to be a little bit more quiet before I get to know you. And I always tend to ramble. Like, my videos, I'm not kidding you. I, redid one of my videos because I thought, I am rambling here and I need to be concise in what I'm saying. So I was like, nope, we're scrapping that, starting over.
I ramble too. I had one that was 12 minutes, but then I redid it. It was down to 3.5.
Nice.
Right. So I'm interested to know, what is everybody's goal with this? Why are you in the program?
Oh, gosh. So I've always wanted to get my doctorate, but I didn't want to get my doctorate to say I have it if it wasn't really what I wanted. And most of the doctorate programs I had seen was all research, and I like research. I knew that that's not what I want to do with my whole life. I don't want to go into athletic training research. So why would I do a doctorate that's all focused on that? And so when I came across this program, it was like, oh, this is different. Yes, there's a research component, but it's a different type of program. And it was like everything just clicked. I'm going, this is what I want. Like, it hit all my check marks, and it was just kind of one of those, you knew that that's what you wanted the second you saw the program type things for me. And I don't have any plans to leave my current position. I like where I'm at. I love my kids. I love my coaches. So, and I get that question from people at my school, are you going to leave? I'm like, no, I'm not leaving. I'm not going anywhere. But I like the fact that it does open up some more doors and opportunities. And, 2 years from now, I might have a different opinion and things in my life might change. And all of a sudden I want to take a different position. But that's kind of my, my why and what I want to do with it.
I guess I'll go. With me, my head at my undergrad at Eastern Illinois is an alum from Indiana State, and he just kept on talking about the DAT program when it was starting, and he told me a lot about it, and it just felt like something that I would enjoy doing. Not so much after doing all these videos, but I still enjoy it. But since I'm very new to the profession, eventually I could see how this will open up doors to my end goal, maybe work pro or collegiate.
So I am a PhD student at Indiana State. So my degree is in curriculum and instruction with a concentration in athletic training education. So Dr. Eberman kind of took me under her wing a little bit last year when I was doing my master's, and I worked in the office a little bit and became really close with them. I've known I wanted to get my PhD, so I applied to a couple places, and then that didn't really work. I didn't like the interviews very much, and I came back and was like, Dr. Eberman, I don't know what to do. I kind of think I want to stay at Indiana State. And she was like, well, come on in. And she, so I'm taking the DAT classes because I want to learn more, and it's a part of the concentration.
Nice. Cool. For me, for me, I just wanted to put it all together. All together being like, so my undergrad is in athletic training and my master's is in nutrition. And I just, even though I know there's all this information from Gatorade, and it just seems like we should be at a place where if you get injured, you should be eating these things to help complement you along your recovery. And I wasn't sure how to do that on my own. And like, just with the concussion stuff alone, there's so many pieces of like the psychology aspect of it that I haven't grasped. Like, I'm just now building a good relationship with our school counselor, and we're trying to put pieces together. And so I want to be a better clinician, but I think it's more so not the stuff that we do, every day, but it's all the other things that we don't know much about or have much experience with that I want to be able to incorporate. So when I saw that it had like an integrative approach on the like goals, and I saw that the other programs didn't have that, and I was like, yeah, this is my place.
Yeah, it's almost kind of like you don't know what you don't know.
Yeah.
And like that's how I kind of feel. Like I'm learning all these things and these terms and everything's getting thrown, like, oh, I really don't know a whole lot. Like the one thing that said that clinical expertise is defined as 10,000 hours in a specific skill set. I was like, oh, so I have no clinical expertise. Got it. Clear on that. You think you have expertise because I've been doing this 9 going on 10 years now. Like you think you have a little bit of expertise in something, and you read like something like that and you go, oh, I have no idea what I'm talking about. Okay, got it. And you kind of, get knocked down a peg there, but I think you got to come into something like this being really humble about yourself. And
that's one thing with all the reading it has, like you said, and be humble about it.
Yeah.
I'm wondering how this 2 years is going to be, and if I'll have all gray hair when I'm done.
No.
Right. I wasn't expecting all this reading, even though I know I've done an online program before, but I just was not expecting all of this reading. So yeah, this will be interesting. We'll both have gray hair, Steven.
I already have some. They're just well-hidden because I don't have much hair right now.
Yeah. Well, it's like my husband just started his master's program, and I, just starting my doctorate, and I texted him on Monday and I was like, I'm already overwhelmed. Like, okay, this is a lot. And I have to do how many videos? And I have to interview 2 athletic trainers. What? I'm like,
Oh,
why didn't you tell me about this yesterday when I had a staff meeting? Could have easily gotten it done. But, I think that's part of it, is just putting you outside of your comfort zone and growing and stretching. And change is hard, but you don't grow if you don't change.
yeah.
And that's kind of how I view the outcome assessments. Like, we're in this program because we want to be better clinicians, all of us.
Mm-hmm.
Maybe that's just something we're going to have to learn how to do, figure it out along the way. And, if we're not willing to change our practice and what we're currently doing to meet the needs of our patients, be better clinicians, then we're in the wrong program, I think.
Yeah.
Agreed. I thought it was interesting how I think his name was Kenneth, when he had that video, his intro video. I know this is a
Dr.
different
Gaines?
class. Yeah.
Yeah.
Dr. G is what he said he could be called, so I'm going to use that, Dr. G. How he said it's not about your grades. It's basically like, what you get out of it. And I was like, whew, thanks for saying that. Even though obviously I'm going to try my hardest.
Right.
I like that the emphasis is really on us being better, not just getting a grade.
Yeah. Yeah, that was kind of a, wait, what? What you mean this isn't about grades? Of course it is. But, yeah, like you said, it's understanding that that's not what really matters. You can be a passive learner and get the grades, and you're going to look back 2 years from now and go, oh, that was a waste of time. And I certainly don't want to do that. I don't think anybody does. So like in the Dear Future Me thing, I literally, like, one of the things I said was, I hope you look back and say, despite all the challenges, that this was worth it. Like, that's what I'm hoping for.
Mm-hmm.
There's bound to be a few mental breakdowns along the way.
I think the first weekend, our entire cohort's going to have a mental breakdown.
I know. It's a crying session.
The first hour.
We're all gonna post selfies in our group chat of us just crying, like, oh my gosh.
What did I sign up for?
Like, I legit think the first week or two we'll be like, okay, I got this, like, I can do this. And then about week 4 or 5, we're all gonna be going, oh my gosh.
Right.
I can't keep up this pace anymore. This is too much. No.
Right.
I do think that's one good thing about this program is, though, that they are not going to let you be a passive learner. So you will be involved in it. It is hard and it is a lot, but everyone that I've talked to that has came out of it has just great things to say about it. So,
oh, good.
Yeah. Yeah, I talked to someone who had just graduated at the Indiana athletic trainers meeting just a couple weeks ago, and he's had nothing but good things to say about it. Like, he really enjoyed it and had really positive things. So, I'm hearing good things.
Yeah.
But I don't know if you guys watched any of the videos from the previous graduates, like but the one that Dr. Graves said at the very beginning, she was like, well, I had just started my program. My husband just started his master's, and we had dogs. And I'm like, oh, that's me. You are my spirit animal right now. That's me. Of course, we have 2, and she had 3 dogs. But I was like, oh, okay. So if anybody understands what this is going to be like, I need to pay attention to what she has to say.
Yeah.
I'm just not looking forward to when I'm moving down to Terre Haute, because I have all the assignments and packing up and moving.
Yeah. Well, and like, we're going out to Las Vegas for the NATA convention, and I'm like, oh, okay. Okay, so I'm gonna need to make sure I get that stuff done. Take the laptop, plan out some time to do your assignments, and like the very next week we have a family reunion, so I'm gonna like be in scramble mode. But it'll be fine. We'll be fine.
It'll be fine.
Yeah, it'll be fine.
We actually did it. We're at 38 minutes now.
Woo!
Wow.
Extra credit.
What I'll do, I'll post this on YouTube and send all of you the link so you guys don't have to post it on there.
Okay, do we all have to post the link to our own assignment, or does just one person post it, or?
I'm pretty sure that one person posts it and then we'll all be able to see it. So, but he might not have linked it like that. I can't tell.
Okay.
So I think only one person has to submit it and then it'll show up on all of our Blackboard pages.
Okay, so only one person has to like submit it to Dr. Powden.
Correct.
Okay.
Worst case, we'll have the link as well. So
Okay.
if we need it, you can just post it that way too.
Okay, cool.
All right. Oh, nice meeting all of you.
Yeah, it was good talk.
Yeah. You guys enjoy the weekend.
You too.
Yep, got homework.
Yeah.
Yeah, but all of us. Okay.
Have a nice night.
You too.
All right. Bye-bye.
Bye.